Thank you very much, Kevin. Next, I'd like to introduce Joanne Cunningham. She is the president of the Home Care Association of New York State. They have well over 300 members across the state, and Joanne's going to offer us a perspective on what all of this change means for that very, very important part of the delivery system. I think a segment that's going to be increasingly important based on the focus on readmissions and whatnot. And Joanne, I hope we can talk about that. Thank you.
Thank you. I would say in 2 words, chaos and anxiety. I would also say that everything that Kevin just described as far as CEOs of home care or the hospital sector goes for home care as well. The home care sector in the state of New York has been pummeled as well, not just by many of the policy changes that I think I came here last year and talked about in a lot of detail, but also the other C on your list would be cuts. Last year, in the first Cuomo budget, the home care sector saw $500 billion in cuts and mandates, which I will tell you was not even close to the magnitude that any other sector saw. So in other words, home care really got targeted. We also got targeted with a lot of policy change that came out of these reform efforts that has caused a lot of anxiety and a lot of chaos in the sector. Despite that, I would say that home care sees a lot of opportunity in what's ahead. If you look at a lot of the ACA provisions, health homes, ACOs, other types of payment realignment efforts, I will say home care, I think, is very, very well positioned. And if you leave here thinking nothing or remembering nothing that I said, I would say that the one thing to note about the home care sector is that all of the discussion on post-acute care and reformulating that and trying to deal with the thorny issue of the chronically ill, that is home care's sweet spot. And home care for decades has been maintaining the care and dealing with the very, very complicated issues of the chronically ill, those patients that are driving the healthcare costs in this country. I would say also from the home care perspective, one of the difficulties in a new environment is this competitive environment that we're in, and because there is such a focus on care management, everybody now is a care management expert, and if they're not, they're now developing business lines to be a care management expert. I will tell you, in your midst, you have care management experts, and they are the agencies in your own communities that have been doing this, some of them for 100 years. The VNA of Hudson Valley, the VNA of Westchester, Dominican Sisters, Jewish Home Life Care, VNS New York. They're all in your midst, and I will tell you, they've been effectively managing the chronic care needs of patients in their homes for many, many years. And they should be invited in as partners. And one of the things I would say to those of you that are business leaders, that are taxpayers, is all of the folks that are out there developing business lines to do care management, that's a wonderful thing, but you know what? They are going to have to learn the expertise of how to deliver it effectively. You have already paid for it in your Medicare and Medicaid programs through the creation of the home health infrastructure that already exists in your community. Don't pay for it again by recreating what already exists. Instead, invite those partners to your table. I see some of them have spaces at their tables. Invite them in, hospital CEOs, insurers, physician practices. Invite those experts in. Talk to them about exactly how they are doing effective care management, chronic care management, medication reconciliation, which is a driver of readmission rates, rehospitalization, all of those things. That's right in the center of the home care sweet spot. So I think despite the challenge and all the other C's, there is opportunity area for the home health sector. They just need to be invited in as partners to your table. Thank you.
Thank you, Joanne. Joanne, you touched on value, and Emmy touched on value a little bit earlier. Why, in your opinion, is it so hard for the home health sector to make that case? How much value that you bring to the totality of it? John's talking about programs they're putting in place to reduce the cost of care, and I know from firsthand experience a very successful home health initiative can do a huge amount. Why is it so difficult to get that story out and get, therefore, more respect in the discussion about fair payment for the services being provided?
I actually think that for providers, that home health providers that are part of networks and systems and hospitals, I actually think there's not a hard sell there. I mean, home health agencies have their own data. They collect their own data, say, on their use of telehealth for remote patient monitoring. There's clear evidence that the home health model works. Right. There's national data sets. I mean, I would say that from kind of a health policy standpoint, home health has been a little bit of the unheralded kind of safety net under the healthcare system that has seen tremendous growth over the past 20, 25 years. And with that growth, I think you've seen a sector that has kind of become really good at problem solving without a lot of capital investment, not a lot of attention. And I think the reason for that is it's a very high touch, not low technology because the technology has evolved, but it tends to be a very holistic kind of care delivery mechanism. And let me just put a face on that. The home health agency, say you have a chronically ill patient that has been one of your frequent flyers in your emergency room or in your physician practice. We have a case, and this was an actual patient who was in and out of the hospital for over 2 years with multiple chronic conditions. The agency, it's an upstate agency, was invited in by the hospital and said, look, here's a list of patients that we've just not been able to effectively manage. The patient was enrolled in essentially a long-term care program in the home. The patient was effectively monitored by a team, a very holistic approach of clinical specialists, so nurses, therapists when needed, home health aides when needed, social work when needed, who also kind of filled the gaps in the care delivery. So in other words, the nurses went in and they started looking in the cupboards, looking in the bathroom, looking in the living room, and what are they looking for? They're looking to see, well, what's in the refrigerator? Does this patient have enough nutrition? If not, the agency's on the phone with Wheels on Meals, and that's done. Can the patient get to their medical appointments? No, they don't have a car, they don't have transportation. The home health agency's on the phone with transportation arranging that. There's some rugs in the living room that present a fall risk for this chronically ill patient. What does the agency do? They fix that. I could go on and on. They go into the medicine cabinet. They notice that the patient isn't filling their prescriptions in a timely way, and that's causing some medication issues that then are presenting difficulties, so the patient ends up in the emergency room. They kind of fill all the gaps in the care delivery that's all intangibles that no one really knows is being done, but I'll tell you, your agencies know, and they just do it, and they're really good at it, and that fills a lot of gaps. So I don't think they have a hard sell. I think they are a little bit unheralded, and once you experience and see it firsthand, you get it, and you want to engage them as your partner.
Thank you.